Zygomatic subperiosteal abscess. Before starting this topic, let me give you a small introduction. Ear can be divided into three parts: external ear, middle ear and inner ear. Infection of the middle ear is termed as otitis media. When the complaint of the patient is of short duration, it is acute otitis media, and the complaint is more than 3 months, it is termed as chronic otitis media. The complications related to otitis media is more common in acute otitis media. The infection, it starts behind the eardrum, and once it infects the eardrum, it produces a small hole in the eardrum and pus starts discharging, and from here the infection spreads to the airspace system which is seen behind the ear. This part is called as the mastoid air cell system, which is seen inside the mastoid bone. Let me explain to you. See, if you see this model, you will have a better understanding. This is the ear part, this is the ear canal. So if you go through this, you can reach the eardrum. Infection from behind the eardrum, it spreads behind to this bone, which is called as the mastoid. And inside this mastoid bone, you have an air cell system called mastoid air cell system. So once the infection reaches here, it can spread inside to involve the brain and the related parts, or it can spread from here to outside to involve the neck or the face. In zygomatic subperiosteal abscess, the pus or infection starts from the mastoid and it tracks to the zygomatic bone. This is the zygomatic bone, and this is called as the root of the zygomatic bone, this one. So when it involves the root of the zygomatic bone, because of infection from the middle ear, it is called as zygomatic subperiosteal abscess secondary to otitis media. Now coming to the complaints of the patient. The patients, they say that they have been having ear discharge for some time, and along with that, for past 1 or 2 days, they have noticed that there is a bulge or swelling above the ear and in front of the ear in continuity. That will be the main complaint, and along with that, they will be having fever also. On examination, they will be looking sick and fever, they will be having fever, and on examination of the face, we can notice that there is a swelling above and in front of the ear, which is a diffuse swelling. There will be discoloration of the skin over the swelling, slightly reddish in color. And when you touch that part, it will be tender, he will be having pain. Along with this, if you see this part, the pinna, which is called the pinna, it will be displaced downwards, as shown in this picture. Along with that, you have a ear discharge too. Examination of the ear, after doing nice suction clearance of all the pus, we can see that there is a hole in the eardrum and the pus is coming out from inside. So these are the findings. We need to admit the patient, do all the investigations like normal routine blood test. Along with that, we have to do a renal function test, and the main imaging of choice will be high resolution CT scan with contrast of the head and the face, and it will be reported as infection inside the eardrum as well as the mastoid bone, and there will be abscess collection in this area, that is above and in front of the pinna. These are the findings. So along with that, we need to do the hearing test too, and the pus which is pouring out, we have to take a swab for culture sensitivity so that we can know which bacteria is involved and which specific antibiotic can be given against that. As soon as the patient has been admitted, we have started with IV antibiotic, and as soon as we get the culture report of which specific antibiotic can be given, we can change it to that particular antibiotic. Now, with this antibiotics, along with painkiller and daily suction cleaning of the ear, along with application of ear drops and nasal drops, if there is marked improvement within 2 to 3 days, we can manage this patient conservatively without surgery. So what do you mean by improvement? It means he is feeling better, the fever has come down, ear discharge has decreased, and the swelling has decreased in size. In case within these 3 days it has not improved, fever is persisting, ear discharge is still the same, swelling has increased, and repeat blood test says or reported as increase in cell count, means infection is increasing. In that case, we need to do surgery. As I mentioned before, the source of infection, it is behind the eardrum and in the mastoid, and from here it has tracked to the zygomatic bone. So the surgery will be, we have to open behind the ear, open the mastoid bone completely, this bone which I have shown you before, this one, and open up this bone and remove all the infection from here, and through this we can go to the part which is just behind the eardrum too and clear off all the infection. And the abscess collection here, it has to be drained by a small nick which is made outside, and all the abscess will be removed, and we have to clean with betadine and hydrogen peroxide, and we will keep a small drain which will be removed in 24 hours. So after surgery, the IV antibiotics will be going on for a few days, say about 4 or 5 days, and all the complaint should have come down by this time. Now on discharge, the patient will be getting oral antibiotic along with other medication, and the oral antibiotic has to be taken for 10 days to 2 weeks at least. And the first review will be after 7 days or within 10 days. So this is about zygomatic subperiosteal abscess. Thank you so much.